here so wonyema e wo se wo take a ultrasound scan. Na doctor wa homa no so ene na twetwe nkomo. Doctor, good morning.
Good morning.
Please, how are you doing this morning?
I'm very well, thank you. And yourself?
I'm doing well too. So thank you for having us this morning. So without wasting much time, let's get into today's questions for you. So we are looking at importance of ultrasound scan. So to begin with, what is an ultrasound scan?
Okay, good morning to all our viewers and listeners. This morning, the ultrasound scan was related to pain for ultrasound. A safe imaging technique, information akora or say you see, now you akora say let's be and now ultrasound scan so very essential when it comes to antenatal care.
Okay, Doctor, that was say. And so obi nyama adenti na here say obecha ultrasound scan.
Okay, me that say. So obi nyama you say what say ultrasound scan you say. When blackema we confirm say ampa what are you feeling? Ebiana one will say medicines, but not a new say. It is a new say ampa which are ultrasound scanner a black emma which means say ampa for you feeling. Actually, so a black emma you the location of the pregnancy. Say a normal and not say a ectopic pregnancy. And the one so if you ectopic and then ectopic idea you kaka. It is the ultrasound scan when you lose the way a baby sa you see me so ano emma after so a boy emma utini say area me no so me ta ko miensa. Three, after sleeping a boy and my young man data would be like expected dates of delivery. Maybe you put to bed in this month, next month, the following month. Not a boy after you teach you they say a boy and my youth me they will say a year. Every other someone you fool with some way. Papa just can. I can't just say what was so back. The following month, we sign to try. I can't just say, oh, sign what was so back. It was a show, say, a crown, and say, and I see me, Grandma, you did say, any abnormalities be a what a crown. Abnormalities to say, be a who was I, a devil, now. The line are twisted. Ultrasound scanning one you say, oh, the line or a pepe. And now they will say, a quite it's you that none your friend and cleft slip. A boy, you will say, walk around and be here for you. All fat abnormality be a back. We are seeing more. And I also say, I can come air with you. What you saying? So now I come my but it's a woman you feeling. It's a ultrasound scanner. A boy, you will say, a parano or tiase. And on tiase. And I feel so. A boy, you will say, you see, which is the placenta. And you okay, it was true, it was full. And now I don't have a problem during delivery. It's the ultrasound, am I able to stand your winning?
Okay, doctor, I better was say, Okasa fa says, so, mucha ultrasound scanner. It's me, mamu, abnormalities be a war above franimu. Na, are there some abnormalities be a etimi escape ultrasound scanner? And I say, be a muhu.
Oh, and no abnormalities be a war apparently. That's can no, the friend of abnormalities come. And no ultra amayesha aparano from head to toe. Send me bibia after you. Problem bia a
Okay.
It's your shaming now, ultrasound no, if you may you aparani you. Also 5 fingers. Lily okay, Naso ye okay, Niti ye normal. The bibia to so ye. Or your bar or your bema.
Oh, okay. And you know, I am mammy will be a honoma, a chair and son or matcha, a ultrasound scan. No. And you know, months ben I'll be recommended, and as a week's ben a pregnancy with dear, it was summer than ultrasound scan.
Anybody say, who was the one for your funeral? Anybody say, one with your PE, as on a walk with trust card. Well, first trimester, that is from 4 weeks to 12 weeks. That is 1 month to 3 months long. I was saying, we chat with first come. It's when you say, when you say, what's your name back? Okay, I was saying, when I play ultrasound scan, when you find someone into the gray. Sometimes it goes against you, the mother, and then even the baby. Which one is you have problem? I use me so amount and now. Now, so what's now? My every action was son. I work with child, and then the problem you are. Sometimes you see so other times there is nothing we can do about it.
Okay. And see, in a normal pregnancy, now you say a 9 months, no. How many times now was say a mother no ultrasound scan every month with?
At least when you say when chaperone, at least 3 to 4 scans a year. I will say that is the first trimester scan. That is from 1 month to 3 months, no. Then we made pregnancy. The anomaly standard number from 18 to 22 weeks. Now we see the HSR scan and some the later part of the pregnancy cram and to assess say oh baby no or the little labor or the line eba baby be how I say little our forms is here but we don't say later part no. Now we're saying at the position, taking it later part of your pregnancy, a boy, Emma is me who say, oh, Abraham, the same or day, but a safe for you, the mother and the baby. It's at least 3 or 4 scans throughout the 9 months, you're okay.
Okay. Now, sometimes so you to say, Bimoka say, ultrasound scan necra and yet. Almost say a ha acordano and then be. How true is that? And is it safe for the baby and the mother?
Oh, ultrasound scan is very, very safe. And then ultrasound scan has been in the system for so many years. And I say to say, ama opioid problem, ana apparatus problem because ultrasound scan use radiation. To say X-rays near Adena AI challenge. Ultrasound scan is so safe and harmless.